Hi. Excuse me. Hi, Dr. Val here. Welcome back to another Sleephoria Live mini webinar. Today, I'll be talking all about restless leg syndrome. And sorry, I don't know why my voice is so scratchy today. So, restless leg syndrome, or RLS, is a sleep disorder, but also considered a neurologic disorder that can disrupt the quality of sleep that you're getting. Typically, it happens at the end of the day, or when you're tired, or when you're just sitting. It is more common than women. I'd say about double in women than men. Estrogen can play a role in this. We know this for pregnant women. One fifth of pregnant women can have restless leg syndrome. Sometimes it goes away after they're pregnant, but sometimes it can actually continue. And rates are higher depending on how many kids you have. So, really interesting. Another big part for restless leg syndrome in terms of prevalence is actually there's a genetic component. So, about 50 to 60% of people who have restless leg syndrome can have a family member, typically a first degree family member. So, if you do have symptoms of an urge to move your legs, and sometimes that symptom is not really well described. Sometimes it's just an ache, an itch, a creepy crawly sensation, maybe like ants rolling around. Typically, it's not pain. Sometimes patients have told me it's like an energy or an electric shock type feeling. And if you have that, talk to your relatives, talk to your mom, your dad, your aunt, your kids, because they may have that as well because it just as a genetic component. And then how is it characterized? Meaning, how do we make the diagnosis? There's no specific blood work that we can do. There's no biomarker that says, oh, yep, you have that positive. Okay, you have restless leg syndrome. It's really based on, a good clinical history, talking to your physician about it to see if this is something that is true for you. So an urge to move your legs gets worse with the evening or at the end of the day. So there's a circadian component to it. Gets better with movement. And if it bothers you more than 2 times a week and keeps you from sleeping, then we consider restless leg syndrome. And some people can have this sensation every now and then, and we call that more intermittent. If it's more chronic, then it happens, on a nightly basis. And then there's another category where it's refractory, where you've tried some medications and it still doesn't work. And we'll talk about the treatment a little bit later. So diving in, let's figure out, well, why does it happen more in women? And that's a good question. I don't think we have all the details to it. There certainly is a component for estrogen because women have a lot more estrogen than men. And then we see higher rates for women in pregnancy. We also see higher rates in menopause, but the estrogen sort of thing doesn't play out because when you're in menopause, you actually have lower levels of estrogen. So iron can play a big role with this, and women have. If you're having your period a month after month, if you're getting regular periods, you're losing iron through your menses. And so low iron stores in the brain can affect a couple neurotransmitters, glutamate, dopamine, potentially adenosine. Dopamine is a big one that can play a role with movements. Parkinson's can be associated with issues with dopamine, but it's a dysregulation from not having enough iron that can lead to this restlessness at night, which is really interesting. So one of the first steps in terms of treating it is really to check out your iron levels for that. Also sort of interesting is that for women, there's this like sort of constellation of symptoms for folks who can have restless leg syndrome. It can be associated with migraines, right? It can be associated with other sleep disorders like insomnia or obstructive sleep apnea. When your sleep is disrupted and you're feeling tired, it may lead to more symptoms of restless legs. So always make sure you're getting an adequate amount of sleep. And since I'm a medical sleep doctor, I always want to rule out any other medical sleep conditions that can make things worse because sometimes it can really be additive. Another thing too is anxiety and depression. People who are anxious can have more restlessness. And then also people who have depression, some of the antidepressants, actually a lot of them, can cause some motor psychoagitation. We have a hard time sort of staying still and may actually lead to symptoms of restless leg syndrome, except the one that we don't think is associated is Wellbutrin or bupropion. So if you are having symptoms of restless leg syndrome, check your iron levels, check your medication list. Is there anything that could be contributing to it? So antidepressants are huge, and also anti-allergy medications, things like Benadryl, maybe even like the Claritin and Zyrtec. Sometimes that can cause a little restlessness in some people that can disrupt their sleeping. It's really interesting in terms of other conditions. It sometimes restless legs can be hard to tease out because as we get older, we have other medical conditions. Sometimes we have arthritis that can cause like our legs to feel achy, or sciatica issues, or sometimes we have neuropathy, which is just, problems with our nerves from diabetes, or certain vitamin deficiencies can cause it. So there can be mimics to restless leg syndrome. So it really takes a good clinician to figure out, oh, this truly is restless leg syndrome. You have low iron, it runs in your family, versus, you know what, I think your diabetes just needs to be treated a little bit better. And then also medication induced, right? Taking a look at your medication list. So those are sort of the basics for restless leg syndrome. Now let's move on to treatment, right? So if you're someone who's suffering from an inability to fall asleep because your legs are just really bothering you and you have a hard time settling down, maybe you've tried some massage and it hasn't been working. Actually, one patient who really enjoys doing Epsom salt baths. And so her restless leg syndrome happens in the middle of the night. And so she'll actually wake up and get out of bed, jump in the bath, or run a bath, and actually that helps her fall asleep. Typically, the restless legs, and I say restless legs because I think it initiates in the legs, but it can also happen in your arms. It can happen in your truncal regions as well. And so it's not it's not only in your legs, but I would say typically that's where it starts. It typically does only happen at night, but sometimes it can persist where it keeps people up for hours upon end, and then it could get worse where you start to have the symptoms during the daytime. Yeah, so it's not necessarily a fun condition to have, but there are treatment options. So again, always check your iron. Reducing alcohol and caffeine has been shown to help as well. So lifestyle matters. Exercise, right? Leg stretching exercise can be really beneficial. Again, treat other sleep conditions. If you have obstructive sleep apnea, if you have insomnia, addressing those issues may help with your restless legs as well. And in terms of FDA approved medication, there really only are, let's see here, 1, 2, 3, 4. So dopamine agonists were usually the ones used initially, but they can cause something called augmentation. So when I talk about a dopamine agonist, Mirapex or pramipexole, ropinirole, or Requip, if you've been on those medications, basically it can cause something called augmentation, where if you've been on them for too long, they just don't work. You start to have the symptoms during the daytime. So sometimes what we do is we decrease the dose, or we switch you to a different class of medications. I saw someone recently who was taking 3 tabs of the medication throughout the day, but was still having problems with his legs. And so we're going to see if we can switch him to the patch. And so because when you have a patch called Rogaine, it can actually, the medication stays in your bloodstream for about 24 hours. So hopefully that'll help if his insurance approves it. Some of the research suggests now, there was a Mayo Clinic proceedings that recommended that we actually start gabapentin as first-line treatment, really to avoid augmentation. Gabapentin is used for neuropathy. Sometimes it's used for mood disturbances, or that it can help. It makes you sleepy. And so that can be really helpful if you're having a hard time settling down because your legs are bothering you and you take a medication that's sedating. That potentially can help as well. So non-medication treatment options are things like massage, leg exercises. I do have some patients who want to get those leg compression devices. I don't know if you've seen them before. Sometimes like runners use them. I sort of say it looks like you look like the Marshmallow Man, where you like put these things on your legs and just squeezes them. If you find that helpful, they are pretty expensive though, so several $100s. Some research says that actually can improve it. Some other treatment options that are non-medication include things like transmagnetic stimulation. Can we actually stimulate the nerves or the muscles? I'm not exactly sure how that works since I don't do that procedure. Acupuncture. I'm a big fan of Chinese medicine. I've used it personally myself. And if you can tolerate needles, you may want to give acupuncture a go. And then yoga. Leg stretches, may be really helpful for you if you do have some issues with restless leg and falling asleep. Yoga is also great because it can help improve that parasympathetic response, where if you're, having a little anxiousness because you're having a hard time falling asleep because your legs bother you, can you get into that meditative state where you do some downward facing dog, some child poses, some legs up the wall, slow down your breathing, and maybe that can help you fall asleep easier as well. So this was a mini webinar about restless leg syndrome. Yes, it happens more frequently in women, especially around pregnancy, but also there's a big family history component, and women in menopause can have it as well. So if you have a hard time sleeping and you think it could be from your legs or other uncomfortable sensations in your body, please talk to your physician about it. As a disclaimer, I am a medical doctor, but I'm not your medical sleep doctor. So if something comes up from something that you're watching in our videos, please seek out professional care in your area. Hope you found this video helpful. If you have any questions, go ahead and put it in the comments. Also, please sign up for our newsletter where weekly we'll send out, just some information, recaps on some of the events we're having or some of our latest blog posts. And then I curate a couple women's sleep articles or women's health articles from the news for you to read as well. And I also like to include a nice quote, and sometimes we have journal prompts as well. So thank you so much for watching my mini webinar, and welcome if this is your first time watching one of our Sleephoria videos. Hope you had an interesting time and it was educational for you, and have a great rest of your day. Bye-bye.